I am here because this is some kind of interdisciplinary congress. A lot of specialty, a lot of different doctors from different areas of activity, clinical researchers, academics, units, practitioners come here because immunology is a big issue and nobody knows all the truth. And we need to start to talk about each implication in this problem. Immune system can be good or can be bad, and immune system defend us, but immune system can hurt us. Like I say, in lupus or dermatomyositis, which is autoimmune disorders, and in this case, our immunity is higher and fight against us. On contrary, when our immune system is low, we have a lot of infection. We cannot defend against environment. And so it's better to have a balance for immune system between bad and good. Protect and don't hurt. Low-dose immunotherapy or microimmunotherapy, it's a step in the front because we need to use lowest possible doses about a specific drugs, about a specific cytokine, about a specific peptide in order to obtain the maximum benefits. We don't have to use a lot of drugs. We can use minimal drugs but very targeted, only when we want to attack, only on what mechanism we want to influence. Yes, rosacea, it's a complex disease with predisposing factors, with the genetic factors, with trigger factors, UV, Demodex follicularum, heat, stress, microbes, everything can trigger the disease. And also we have troubles in immune system, both innate and both adaptive system. It's genetic. It is genetic. It's not accurate. It's genetic. And we have problems in epidermal barrier, we have problems in vitamin D, we have problems in toll-like receptor 2. We have a lot of problems. And these problems can trigger other mechanisms. Vascular dysregulation, and this is the problem, can trigger adaptive immunity with B and T cells. Yes, it's important because azelaic acid, topical azelaic acid, it's a good immunomodulator. We have a lot of research, a lot of scientific literature about the implication of topical azelaic acid in immunomodulation. Also, the cyclin, the antibiotics from cyclin and macrolides, it's a good immunomodulation. We don't talk about antimicrobial, we talk about immunomodulation. It's a very important because we give doxycycline to the patient not for antibiotic effects. We give for immunomodulation effects. And immunomodulation is totally different with immunodepression. Immunomodulation means we only modulate the immune response without immunodepression. Immunity is good, but we modulate immunity in the benefits of our patients. It is azelaic acid, it is topical azelaic acid, it is cyclin antibiotics, it's macrolide antibiotics, it is lasers. Lasers can modulate our this. And of course, the future is nanotechnology. To send in our skin the nanoparticles full of active drugs. Yes, we have other treatment. We have laser. We have some kind of for regulate the vasodilatation. We have antiparasitic drugs. It is a lot of drugs. But my talk was about immunomodulation, starting with innate and adaptive immunity dysfunction. And this, I talk about this kind of drugs. Holistic approach. Holistic approach. First, consultation, general evaluation of health, local treatment, sun protection, pay attention to diet, general treatment, laser treatment, holistic approach. Okay, I do investigation for associated cardiovascular disease, for associated gastroenterological disease. It's possible I do investigation for the face. It's special photo with a special software which analyze and give us a lot of information about the deep of our skin.